Dr. C, what can I do to relieve my menstrual cramps?
10 things, 10 non surgical options for treating menstrual cramps. So, how can I relieve menstrual cramps? This is a common question that certainly I get as a gynecologist. Many women seek advice on how to deal with menstrual pain and discomfort, simply because menstrual cramps, what we call dysmenorrhea, can be quite uncomfortable and disruptive to a woman's quality of life. And I'm going to share 10 things, 10 non surgical options for treating or improving menstrual cramps. The first 6 things are going to be things that you can do at home, lifestyle changes that you can simply implement that may help to improve your menstrual cramps. Then I'm going to share a number of medications that could be used, some of which can be gotten over the counter. Then we're going to look at complementary or alternative medical therapies that can also be used to improve menstrually related pain.
Number 1.
Number 1, heat therapy. This is, a very old, well-known method that is used for managing menstrual cramps. Applying a heating pad or hot water bottle to the lower abdomen can help to relax the muscles and alleviate pain. A warm bath also can be beneficial.
Number 2.
2, exercise. Exercise, yes, is very important. Light physical activity, such as stretching or walking, can improve blood flow and actually help to reduce menstrual cramps.
Number 3.
3, relaxation techniques. Practices such as deep breathing, exercises, meditation, or even progressive muscle relaxation can help manage pain and stress and the tension that is related to heavy menstrual cramps.
Number 4.
Or dietary changes. It's very important to understand that what we eat has an impact on our bodies overall. So, having a diet that is balanced, that is particularly rich in omega 3 fatty acids, and we tend to get omega 3 fatty acids from our fruits such as avocados and vegetables, but particularly from oily fish such as salmon, sardines, mackerel, herring. These are rich sources of omega 3 fatty acids. This is important in helping to reduce inflammation overall. Also, staying hydrated, avoiding excessive caffeine at the time of your menstruation, as well as reducing salt intake at the time of menstruation, may actually be beneficial in improving menstrual cramps because it helps to reduce water retention.
Number 5.
Number 5, supplements. B vitamins overall, as well as vitamin E, have been noted from research to have potential in decreasing menstrually associated cramps and pains. And so, therefore, it's very important to ensure that you top up. So, it may be beneficial if you're concerned that you may not be getting enough from your diet, that you're topping up with supplementation of particularly omega 3s, as well as vitamin D, B, and E. Okay?
Number 6, chap.
Number 6, herbal remedies. If you're new to the channel, all our content here is designed around empowering women through quality health education. When women are able to take care of their health and understand their health, they're able to live healthier, happier, and more fulfilling lives. So, of course, if this is also important to you, then make sure that you smash that like button, share this video, and subscribe so that together we can continue to enhance the quality of life of our women. All right, great. There are a number of herbal remedies that have been shown to have benefits in terms of improving menstrually related pain. For example, ginger, chamomile. These, apart from being very flavorful for your tea, they also have anti-inflammatory properties that may be beneficial in improving menstrual cramps. So, yes, get some tea. All right, let's talk a little bit about medications. Sometimes the symptoms may not respond just to these lifestyle changes, and medications may be necessary. And before I mention these medications, I would urge any woman who is having such severe menstrual cramps that is disruptive to her life to the point of needing medication, it is in your best interest to have that checked out to make sure that this is not due to some serious underlying problem that may need specific medical or surgical attention. So let's talk a little bit about the medications that may be used.
Number 7.
It's quite reasonable, for example, to use anti-inflammatory pain relieving medications, and these can oftentimes be accessed over the counter. For example, ibuprofen, naproxen. These are medications that very effectively reduce pain and inflammation. And it's best to take these at the start of the cramps for maximum effectiveness. I know there's a tendency to try and tough it out, to try and wait to see if your symptoms will progress or improve and to see if you can bear it before taking anti-inflammatory medications. But one of the things that evidence has shown is that the earlier you break the pain, the more likely it's going to be effectively managed. And overall, perhaps the less you will need to use of the medications. And this is important because quite often I've found in my practice that many women having painful periods may oftentimes overdose themselves on pain medications. I've had many patients come to my office, and when I ask them what doses of medication you're taking, they're actually taking doses far beyond the doses recommended for therapeutic management. And so they are exposing themselves to potential toxicity. So make sure that you start the pain medications early so that it's more effective.
Number 8.
Number 8, hormonal birth control. For some women, hormonal contraceptives can be very effective at reducing the severity of menstrual cramps. They're also effective in that they may also regulate periods, and in some cases, for women who may not want to see their periods at all, because quite often many women who have painful periods may also have heavy periods. This is an option that is particularly useful for women who also want contraception. So you're not planning to get pregnant just yet, and you're having painful periods. It may be useful to utilize hormonal birth control as an option of not only providing effective contraception, but also relieving menstrually related pain.
Number 9. Almost there.
Number 9, let's talk about alternative and complementary therapies. Acupuncture, for example. There are some studies that shows that these alternative therapies may actually be effective in reducing menstrually associated pain.
Number 10.
Number 10, transcutaneous electrical nerve stimulation, or TENS, is a treatment that essentially involves using small patches that are collected to an electrical source, and these electrodes or electrode patches are applied to the skin near the area of pain, and they give small electrical impulses, not enough to cause harm or discomfort, but these electrical impulses may be used to treat pain in many conditions and may actually help to reduce pain related to dysmenorrhea in some patients. So there you have it. 10 options that may help in relieving menstrual pain.